To the battle against HIV and AIDS. Some of the top minds in the field are converging this week in Boston. One report that's causing a lot of concern is a new CDC projection of HIV risk, which finds if current trends continue, about half of black gay men will be diagnosed with HIV in their lifetimes, a quarter of Hispanic gay men, and 1 in 11 white gay men. African-American men and women, as well as Hispanic men in general, have a dramatically higher infection rate than the rest of the population. The good news is, overall, HIV diagnoses have declined. The bad news, the disparities are immense. Joining me are Sean Cahill's Director of Health Policy Research at the Fenway Institute, where he works on LGBT health and HIV policy, among other issues. He's also on the Massachusetts Commission on LGBT Youth and a co-author of LGBT Youth in America's Schools. My God, enough. We're also joined by Corey Yarberry, co-founder of the Hispanic Black Gay Coalition. Gentlemen, it's great to see you both.
Thank you for
Why
having us.
such a disparity? What's the explanation for this?
There's a number of reasons. One is access to health care. We know that Black and Latino Americans are less likely to have health insurance and to be able to get preventive health care. So we see that within the gay male population.
How about the notion that they're engaged in more at-risk behavior? Is that a myth or no?
Myth.
Myth?
Definitely. And a huge,
Why is it a myth? How do you know it's a myth?
It's a myth because studies have shown it. The CDC has also studied this and shown that black men in particular, black and Hispanic MSM men aren't engaging in more activity, but the prevalence within their sexual networks and their communities are simply higher.
Do you agree with Sean in terms of the causes, the lack of health care, lack of access to health care, that sort of thing is the primary item at the top of the list?
Definitely. I would put it towards the top, yes. I do think that is a leading reason, but I also think in addition to just looking at trying to treat a disease, we need to look at empowering an entire community.
What does that mean?
That means looking at how we value the lives of Black and Latino men in this country and looking at all of the policies and how they interact with health behavior and one's ability to access quality health care and improve their lives.
But when you say how we value the lives of black men or black gay men, Hispanic gay men, who's we? Do you mean the government? Do you mean the population as a whole? Who do you mean?
I mean American as a whole, not only our culture, but our policies.
You know, the head of the CDC's National Center for HIV/AIDS says, here's a quote when this thing came out, as alarming as these lifetime risks estimates are, they're not a foregone conclusion, they're a call to action.
That's
so
right.
what action? Well, what are the primary couple of things that pass the laugh test in terms of being doable, that could be and should be done here,
Right.
Sean?
Well, we know how to prevent HIV transmission using condoms and lubricant. We have pre-exposure prophylaxis, which is a new approach to prevention, which involves taking HIV medications for preventive purposes.
90% effective?
More than 90%
like
if you're treatment adherent. It's close to 100%.
Can you go back to the first thing?
Yeah.
People don't know this?
Well, people know, but you know, we're not doing a good job in our schools of teaching young people how to protect themselves. We have the broader context is we have 20 million STIs a year, sexually transmitted infections. 10 million of them are occurring among adolescents and young adults. And the vast majority of those people getting the STIs are heterosexual. So we have a broader sexual health problem. We need to be promoting, teaching people how to stay negative, how not to get infected with HIV. And we have a lot of states. We have 8 states where they have what are called no promo homo laws. Laws that prevent any sort of neutral or positive description of homosexuality. So you can't talk about homosexuality, same-sex behavior.
Where are they mostly in the South?
Four of them are in the South. Texas is another one. So they're mostly in the Southeast. So that's one issue. The other thing would be Medicaid expansion. Half of Black Americans live in the South. The southern states, for the most part, are not doing Medicaid expansion. So there's 3 million people who are caught in this gap where they're not poor enough to qualify for Medicaid or categorically ineligible because they don't have a dependent child, but they can't afford subsidized insurance on the exchange.
You know, it's an extension of what we're discussing with Governor Weld. So many of the Republican governors don't want any expansion of Medicaid because there's the word Obamacare attached, but these are the real world consequences of this.
And with Medicaid expansion aside, a lot of these strategies we've had for years, and which is why, in my opinion, we need to again go back to the root of the problem, which is racism in this country, and also the policies that are rooted in racism, Medicaid expansion being one of them. But we need to look at our entire healthcare system. So when an individual who may be a Black MSM male go into a healthcare system, are they receiving culturally competent and sensitive care? Are they engaging with leaders and HIV advocates who speak their language and can speak to their culture? that is a huge problem of what is missing.
Is part of the problem also that, you know, our empathy for people who are suffering through whatever they're suffering through in this country goes in cycles. You know, it's homelessness, it's HIV, it's whatever. Has much of America moved on from this as life expectancy has increased, and it has in virtually all these groups, even though slower for people of color. Have most of us moved on and said this problem has pretty much been fixed, and so we're elsewhere? Do you know what I mean?
Right, right. And I hate to sound like a broken record.
Feel
but
free to be a broken record.
I agree that you know, in a lot of ways, some people have moved on because, as you mentioned in the introduction, HIV rates have gone down for the general population, for the white population, and for the white gay population. And so, who is often left behind in those conversations are Black and Latino men, and how we are still struggling with the epidemic. And so until we can recenter the conversation, as well as talk about how homelessness, employment, and economic status all interacts with one's ability to stay healthy and have access to quality health care, we will not solve this problem.
What's your sense of where the public is in this? I mean, the Fenway is the epicenter of a lot of this work.
I think on the one hand, the advent of antiretroviral medications 2 decades ago caused some people to think that the problem has been solved. But I would say that under this administration, we've seen incredible attention to HIV prevention and care, more attention than we saw under the Bush-Cheney administration in terms of domestic prevention and care. We've also seen a lot more attention to LGBT health more broadly, lesbian, gay, bisexual, transgender health. And so what Corey was saying about cultural competency, it's absolutely critical, particularly for Black, gay, and bisexual men. There's a lot of medical mistrust in this population. There's a lot. There was a study in the American Journal of Public Health last year that showed that a lot of Black gay men experience either racism and/or homophobia in healthcare. So that prevents them from getting an HIV test, from disclosing their sexuality to their healthcare provider. So those are things that we can change.
Sean, it's good to see you. Thanks for filling the blanks.
Thank you.
Corey, you as well. I
Thank
really
you so
appreciate
much.
it. It's a pleasure to meet you.